Health Minister Dr. Aaron Motsoaledi has expressed shock following the gruesome killing of a mental health care patient at Philadelphia Hospital. The 45-year-old suspect is suspected to have experienced drug-induced psychosis after taking crystal meth. He allegedly attacked 3 patients in the ward, but 2 managed to escape. He continued to assault the 33-year-old patient to death. The man allegedly also beat off the body of the deceased patient and ate his flesh in the process. Motsoaledi says the armed security officers from the hospital failed to contain the man. They locked him and the deceased behind the security door in the ward and shot him with rubber bullets while he continued to attack the deceased.
This man was admitted on the 5th. And we understand early hours of this morning, he woke up to attack the other 3 patients. The other 2 were able to run away and escape. And the deceased is the one who remained in the ward. The most bizarre part is the behavior of the security officers who were called here. Because there are security officers in this hospital. They came in, but I understand they actually ran out of the ward. They are armed. This man was not armed. He was just hitting the deceased with everything at his disposal. I am made to understand they ran out and locked the grill door. And they were shooting rubber bullets through the grill door, not in the ward. They were outside. They hit him with at least 10 rubber bullets. I could count the 10 rubber bullets.
Dr. Motsoaledi has directed the hospital management to suspend the security company with immediate effect from the hospital.
How do 2 armed security officers fail to restrain one man when they can see he's killing somebody and fail until the person is eventually killed? It's very bizarre. So for this reason, I've asked the DDG, the MEC is here, and the DDG, that security company must be suspended from this hospital with immediate effect. Because what else are they capable of? They must immediately suspend them with immediate effect. I, in discussion with the Deputy Minister, will call South African Police Services and will call CIRA, the private security industry, regulatory authority. We'll call the Mental Health Review Board. I've already spoken to the chairperson of the Ministerial Committee on Mental Health, Professor Ataimani. I've been speaking to him the whole day. They need to come and assess. We need to assess the security situation. We'll have to assess the security situation of the private companies that are hired in Limpopo, because you remember, very recently, there's a nurse, 2 nurses who have been raped with security companies there, and it's not very clear what was the role of security. So we can't keep on allowing this to happen. But the most recent one is very, very bizarre, to say the least.
He says all private security companies at the health facilities in Limpopo have to be reviewed following this incident and the rape incident of nurses at Koketšo Clinic in January this year.
It is also bizarre that the police also were waiting at the grill door, 8 of them, and they end up saying they are waiting for the public order policing. I don't know whether that information is true, but that's what we are getting here. The young doctor who was called in is a young female doctor. She's still very, very traumatized. She witnessed what was happening there, and she too said she was protesting to the security that, look, but you need to go in. That man looks to be dangerous, and you are armed, you must help. But they refused. That's why the doctor now needed, psychologist counseling, because it traumatized her. She's still very young.
Deputy Minister of Police, who also visited the hospital with Dr. Motsoaledi, says the police have arrested the suspect.
The case that we're investigating is murder. So we've opened 3 cases in this instance. The first one is murder and the 2 are attempted murders. Yes, he's in the ward because he's got a cut over his head and then still going medication, but he's arrested and then he's under, they fastened him, and also police are here to guard him 24 hours.
Minister Motsoaledi says the hospital staff will receive counseling following the incident. I'm Koketšo, Motau, SABC News, Dennilton.